This is Mark with My Family Health Insurance. Today what I want to do is give you basically a health insurance 101, how to understand your health insurance plan. So if you're like most people, insurance terminology is very confusing. But what we want to do through this really simple illustration is to take some of the most common terms in the insurance business, in-network, out-of-network, deductible, co-insurance, copay, and maximum out-of-pocket, and use it in a real simple illustration here so you can understand just how all of this comes together so you can make it all add up. So here we go. Let's start out with in-network versus out-of-network. In-network means that's who your doctor is. So when you buy, let's say, a Blue Cross Blue Shield plan, your doctor needs to participate. That way you get your in-network benefit. You also want to make sure your hospital and other facilities that you may use is also in-network. So some areas Blue Cross is stronger than some insurance companies, and at other areas, other insurance companies are better. So you definitely, when you're out shopping your insurance, you do want to see, is your doctor in-network with the plan you're looking for? Then there's out-of-network. Well, what does out-of-network mean? Well, again, using Blue Cross Blue Shield, if you have a Blue Cross Blue Shield plan and you see a doctor, specialist, or go to a hospital that doesn't participate with them, you're out of network. So what does that mean? Well, this is how a simple policy would normally look. If you go in network, your deductible is lower in network than it is out of network. So they kind of, put a little bit more money out of your pocket for going out of network. So they want you to stay with their insurance company and their providers. So whenever we talk about benefits, we talk about the in-network benefit, assuming you're just not going to ever use that out of network if you can help it. So what's the deductible? A deductible is usually a large sum of money that you have to pay before a significant surgery or procedure that's considered outside of the copays. So if you need a surgery or if you go have some kind of colonoscopy or some other things that are perhaps exploratory or whatever, you would expect to pay your deductible. Coinsurance. What does coinsurance mean? Well, a lot of plans are 80-20 plans. So your coinsurance is insuring part of your medical plan between you and your insurance companies. So an 80-20 coinsurance means after, on a significant procedure, after you've paid your $500 deductible, now in this illustration, the insurance company is going to pick up 80% of the cost, and you will pay 20% of the costs up to a certain amount of money. Copays. What are copays? Well, they're distinctly different from deductible and coinsurance. Usually they're small, flat dollar copays. So that might be like a $20 office visit. It might be a $15 copay for generic drugs. It might be urgent care at a $50 copay. So copays have nothing to do with deductible and coinsurances, and when you understand that, it makes this understanding insurance much more easier to do. Then the last term I want to bring up is maximum out-of-pocket. Starting with Obamacare plans in 2014, all plans must have a maximum out-of-pocket. So in this illustration, the maximum out-of-pocket is $3,000 in network. So if you have something very significant happen, you know that's the most you're going to pay. That includes copays, all of your coinsurance, and your deductible. So it's all inclusive. If you go in network and out of network, then you've got two of them you've got to work on. You've got a maximum out-of-pocket in-network here and a maximum out-of-pocket here in the out-of-network. So you want to be careful about that and always work with your doctor to keep you in-network whenever possible. So here's an illustration. Let's say you have a surgery and it costs you $15,000. Well, how would you pay for that? Well, based on the simple plan, you take that $15,000 surgery and you pay that $500 deductible. Now for the rest of your plan year, you've met your deductible. So now the balance of the bill is $14,500. Well, if you recall, I said you paid deductible before coinsurance. Now you've met it. Now, with that balance of $14,500, the insurance company is going to pay their 80%, which is $11,600. Your 20% of this is $2,900. So when you take your $500 deductible you paid right here and add in your $2,900 for coinsurance, your out-of-pocket is $3,400 if you do the math. However, there's one thing we need to take into consideration. In this case, your 20% took you up to $3,400 when your maximum out-of-pocket is $3,000. So this is how it really works. Let's just add the whole thing up. You take your maximum out-of-pocket in network, $3,000, subtract the $500 deductible, leaving you with $2,500, and then your coinsurance at 20% is the remaining $2,500. That took you to zero. So out of this $2,900 that was your 20%, that has just been changed to $2,500, or it's been reduced. So that's the way these plans are made moving forward. Your maximum out-of-pocket is truly maximum as it shows here in network and out of network. And then finishing this off, what does true maximum out-of-pocket mean? It means for the rest of the plan year, and in this case in network, no more deductibles, no more coinsurance, and no more copays, which is very interesting. Because on old plans, it used to be before Obamacare that even when you met your deductible and maximum out-of-pocket, you still had doctor's office copays you had to meet if you went to the doctor. You had prescription drug copays that you had to pay, and copays such as that. So those all disappear now. So if you do hit your maximum out-of-pocket, you can expect for the rest of the year, all of your copays disappear as well. No more doctor's office visit copays, no more prescription drug copays, and again, no more deductibles and coinsurances. Hopefully that helps you to understand how health insurance plans with Obamacare works, and we look forward to talking to you on our next Health Insurance 101.